So I now invite Faye Twerski to the podium to introduce our speakers and to begin our program.
Thank you for having me. For those of you I haven't met, Faye Twerski, I'm the president of the Arthur M. Blank Family Foundation. Mental health, as our Director of Mental Health and Wellbeing, Beth Brown, likes to say, we all have mental health. The question is, how healthy are we? And we know that mental health challenges affect everybody. Since the pandemic, we know that anxiety and depression among adolescents has doubled just since the pandemic a few years ago. Suicide is now the second leading cause of death for young people aged 10 to 14 and for those aged 15 to 24. Let's just let that sink in for a minute. Those of us who had kids home for Thanksgiving, what a challenging fact that is for us. 1 in 8 adolescents have experienced a documented instance of abuse or neglect. These are our children, 1 in 8. Unfortunately, Georgia ranks 48th nationally in access to youth mental health services, with just 8 child psychiatrists per 100,000 residents versus the recommended 47. There's more. I'm not going to go through all the data points, but the point is that we are really having a kind of pandemic after the pandemic in mental health, and particularly affecting adolescents. The Arthur M. Blank Family Foundation adopted mental health and well-being as one of our core areas of giving, and in part in response to some of the statistics that I just shared with you, but also recognizing that this is a challenge facing the entire nation. We adopted and our board approved a strategy for mental health prevention for young people 0 to 18. And our strategy, we follow the data. Our strategy focuses on sort of 3 different key points in a young person's life that we have found to be really essential in terms of trying to change the trajectory of mental health challenges. The first is 0. We know now that when a child is born, that period of connection and attachment between child and parent is key. And so that's our first area of focus, is that very earliest stage. The second is in the elementary years, trying to help support young people as they are managing their anxieties, managing their nervous systems. And we do a lot of that work through schools, although not exclusively. And then our third area is the topic of this conversation. I'm about to turn to our guests here. And that is where we're focused on adolescence and the teen years, and particularly digital mental health and the areas that we can support to prevent worse conditions from happening. Our strategy is national, but we have a special focus on Georgia. We have invested in some of the partners who are around this room to support your work. We're members of the Georgia Mental Health Collaborative, a pooled fund that's housed at the Community Foundation with a collection of funders, and we support efforts to help bring mental health services to all of Georgia. And I want to call out our 2 colleagues, Beth Brown, our Director of Mental Health and Wellbeing in the back of the room, and Taisha Short, our newest member of our team, who really carry the work for our team. I'm pleased to introduce our panelists, and you have long bios, so I'm not going to review all the bios because we will be out of time. But I'll just give you a sense of who is here. John Constantino, who most of you know, we're just thrilled that you've come to Georgia. John is the Liz and Frank Blake Chair for Children's Behavioral and Mental Health at Children's. He is the System Chief at the Center for Behavioral and Mental Health, and the Children's Healthcare of Atlanta Vice Chair for the Department of Pediatrics at the Emory University School of Medicine. He is a nationally recognized psychiatrist advancing innovative systems of care who was recruited here from St. Louis Children's Hospital in 2022, and we're thrilled to have you here, John. I'm going to go through all of you, and then I'll come back and start a question with you, John. Next, we have Beth Finnerty, who is the founding president and CEO of Skyland Trail for 35 years. She is a national leader in adult and youth mental health treatment systems, and especially for program innovation. Thank you for being here, Beth. And then Emily Acker is the president and CEO of Hillside. Hillside, she is a 30-year leader in children and adolescent mental health treatment, and she has been for 10 years in the leadership of Hillside, where she has expanded its proven continuum of care to include community programming and prevention. So thank you all for joining me. And John, I'd like to start with you. If you could give the folks in this room a sense of what is the landscape for adolescent mental health in Atlanta and in Georgia?
Sure. Can everyone hear it? Okay. So first of all, just to express gratitude for so many in this room who are champions of the mental health of children and already do so much to raise all ships in Georgia. And I think we have a great foundation to build on and many opportunities to do that. But one way to think about the youth mental health crisis is as sort of a perfect storm. This crisis has been with us for a very long time. There was a shortage of mental health professionals when I trained in residency in medical school, and that has continued to the present day. The mechanisms for essentially paying for mental health services have not kept up with the innovations of our field over the last 30 years. The conditions are so common that many people who are responsible,
Try this one. Yeah.
many people who are responsible for systems of care for mental health are completely overwhelmed and sometimes paralyzed by the thought of how are we going to manage, what is an avalanche? And then two last.
Want to switch back again?
Sure.
I'm not sure. If you have suggestions for
Okay.
closer.
Okay, thank you. And then two last parts of the perfect storm, and then I'm going to hand to my colleagues. There's been an overinvestment in the far end of mental health, in the late stage crises and catastrophes. And if we don't get out in front of that, we're going to keep spending our resources at the tail end of things that could have been stopped now that we have the technology and the know-how. And then finally, it's important for folks to know that mental health conditions are part of the human condition. They are baked into our biology, and close to 2/3 of the liability for serious mental health conditions of all people are inherited. They're part of our genome. They're part of what we have evolved to, the same kind of factors that make us more social, more emotional, more successful in certain ways. When you have too much of that, can result in a mental health condition. And that gets superimposed by the environment. And the environment is the other third. And as Faye mentioned, to have 1 in 8 of our children in the situation of very serious adversities of life experience, but also now the new adverse life experience for many, which is their smartphone. And the toxicities of smartphones. The smartphones aren't evil, but they are toxic to certain kids, and we have to learn as the grown-ups how to protect them from what this new exposure is really all about.
Thank you, John. I'll come back to you. Beth, you founded Skyland in 1989 for primarily adults. And then in 2017, you led the the organization into serving adolescents. And I wonder if you could talk to us a little bit about what led you to make that change, and how has it gone, and what have you learned about serving adolescents that is unique and important?
Sure thing. Can you guys hear me? Oh, yeah, you can hear me. I want to add my thanks to Johns, to Rotary for hosting this important discussion today. I'm glad to be here and to share some information with you guys. But yes, when we opened in 1989, we were an organization primarily serving adults with schizophrenia and psychosis. Over the next 2 decades, we saw people coming to receive services at Skyland Trail getting increasingly younger. So an average age starting out at 40 or 50 with schizophrenia, moving down to late teens and early 20s. This became part of our strategic plan to look at how to address the mental health needs of younger adults and of adolescents at some point in the future. The board jumped on this, and we opened the Rollins campus for young adults in 2017, which was then followed by many calls from the community, from families, from schools and providers asking us if we were going to continue to decrease our service line to child and adolescents. After surveying the philanthropic community, our board decided to take that leap. It was a little bit more quickly than what we had wanted to, but to meet this demand, we did a capital campaign led by Rex Fuqua and Tom Johnson, and in 2019, we opened a 26-bed adolescent campus, the J. Rex Fuqua Campus for Adolescents, and it's been nonstop ever since. We are seeing the admissions to Skyland Trail. We were thinking it was going to be major depression, eating disorders. What we've seen is obviously the adolescents today are faced with a much more complex environment. They're admitting with much more complex diagnoses, co-occurring diagnoses. We continue to see major depressive disorder, generalized anxiety disorder, and bipolar disorder, but we're also seeing a lot of folks with trauma-related issues and early substance use issues coming in the door, which requires more specialized treatment, and we're providing that through prolonged exposure therapy at Skyland Trail and a substance use program for mild to moderate substance use. We're seeing that families are I want to go to the social media and digital. That's really leading to a lot of these issues that we're seeing, and it's all you can hear about today on the news and in the print and media is the impact of social media on our teens. We're going to talk about that later, I'm sure. But also some of the protective factors are strong community relationships, strong families. Families are an important part of what we do at Skyland Trail. But I do think that a lot of the families across the country are dealing with these mental health crises and isolation. Mental health, mental illness still has with it a strongly associated stigma, unlike they do in physical health. And so I think it's important for all of us across the community to continue to normalize conversations about mental health and really surround and support families who are struggling with these crises.
Thank you very much. Emily, you are at Hillside, which exclusively focuses on adolescents. So I wonder if you could share with us what you've seen in terms of the trends over time, not just recently, but also what have you seen that brings us to recent time, and what are the innovations, some of the innovations anyway, that Hillside has brought to bear to address some of the more emerging dynamics?
Thank you. I do appreciate being here and all of you being focused on this very important topic. We started seeing an escalation in need before the pandemic. And then during the pandemic and after, it was like gas on a fire. The amount of children that were being referred to us who were isolating themselves, they were not coming out of their room, they were not attending school, they were just kind of vacating from life. And you can imagine a parent's pain and concern about their child when they're seeing this. So often we're trying to work with kids to try to reintegrate them, to make sure that they understood their purpose and their worth and their role in the family, and how does the family make efforts to include them. Hillside has always been on that deeper end of psychiatric care. We are one of 6 psychiatric residential treatment facilities in the state of Georgia, and that license or credential means that we can serve children who are funded by Medicaid and private insurance. So Hillside typically treats about 50% of our clients relying on Medicaid for their service funding, and 50% who rely on private insurance. That gives us a lot of diversity, and I'm very, very concerned about access. You heard the data point that Georgia is 48th in the country when it comes to access to mental health services, and that's very alarming to me. So one of the things I've done since I've been at Hillside is try to expand services into various areas or levels of care. We have our day treatment program. We have a virtual intensive outpatient program so that we can serve kids all over the state of Georgia who don't have access to care otherwise. We have an in-home program where we can go into families' homes and not only work with the child, but work with the family, work with the environment of that household, make sure it's safe, and help parents learn how to parent the child they have. But one of the things that's most exciting is on the prevention side, and Dr. Constantino talked about the fact that there's a lot of efforts in the deep end needs, but not enough in the prevention. So in 2022, United Way gave us a seed grant to go in and provide services in an apartment complex in Southwest Atlanta. And we went in and listened first. What do these residents of this complex need most? And we created a plan to help them. We've been in there ever since, and the whole work is prevention work, teaching kids emotion, regulation, distress tolerance, mindfulness, parenting skills, support systems, creating community within that apartment complex so that they can support each other. So Connecting Communities was born, and then we moved into 4 Boys and Girls Clubs and are doing similar work in the Boys and Girls Clubs and hope to expand to an additional 5 more very, very soon. Our goal is to keep kids engaged in Boys and Girls Clubs. We don't want any behavior to get them removed from the club. We want them to be there. We want them to gain all that they can from being part of those clubs, and we want to help train the staff so that they recognize what they're seeing when maybe they're seeing an anger outburst that's really trauma or depression. So that's been a real exciting part of what we've done in the past few years.
And the idea there, Emily, is that by reducing social isolation, that is one way that you are kind of addressing the needs for prevention. Is that the right way to understand it?
Absolutely. It really is reminding not only children, but their families, the community, building that village to help support you, your family, your child, whatever needs come up. That is vital to good health. So when you talk about all those basic needs that we have, sometimes before we can do any type of therapy or treatment with the child, we've got to make sure that they can be fed. We've got to make sure that the lights are on. We've got to make sure that they have that foundation they need to begin the healing process.
Thank you. Each of you, in your own way, talked about the growing need, the growing demand for service, and juxtaposed that to kind of limited supply. And that suggests that collaboration is really important. I mean, collaboration is always important to make sure that we're being as efficient and effective as we can be, but also when there is scarcity, and we heard a little bit of that from each of you, collaboration becomes even more important. And so I'm wondering if you could speak a little bit about that. How do you collaborate with one another? how do you collaborate with other institutions, schools, other important institutions? You just talked about that a little bit, Emily, but I'd love it if you could each speak to that in your own, from your own seat. Yeah, John, you want to start?
Sure. The first thing to think about is that fragmentation is the enemy of children's mental health, of youth mental health. And it's very difficult because people think of some of the things that Emily talked about. Well, does that really belong in the health system, or is that a social thing? Is that really health? Is it really mental health? And the fact is that the reason we're doing so well with conditions like cancer and diabetes is we understand how to get arms around all aspects of the cause of the problem and treat that. In mental health, these are parts of the cause of the problem. And so the kind of work that Emily described is the high bar of integrating what is required to assemble all the parts so that a child or a family at risk doesn't have a crack to fall through. And that is really part of great mental health. That is the state of the field now, but our bureaucracies and our systems aren't necessarily designed to deliver that way, but they could deliver it that way. And so the goal, I believe, is that we must work together. We have to collaborate across the different sectors of the health system, schools, primary care, community services, and social supports for families, because these cannot be marginalized as someone else's problem if we want to own the issue of the resolution of the youth mental health crisis. It's part of the solution to the problem. Yeah.
And can you give us one example, John, of how you do that at Children's? Like, just, I know there's probably many, but how do you, say, collaborate with schools or other institutions?
Right. Well, one of the things that we've been very blessed with at Children's is to be able to begin at a foundation of saying, what would mental health care look like if it was as well done and as effective as health in one of the great health systems on the planet? And the way that that works is to say, let's take the evidence base of the field and assemble it. And it doesn't mean that Children's Healthcare of Atlanta necessarily wants to do everything by itself, but the tack that we have taken there is to say, when we take on a risk or a patient with a mental health condition, the absolute necessity is to assemble that pathway of care. And it often involves Emily's team. It sometimes involves Beth's team at the very high end for residential treatment. It often involves community providers and in-home support workers and schools so that everybody surrounding a child, the village, is coordinated. So concretely, we do it with care coordination and the specification that the health system is going to take ownership of the enterprise of leaving no stone unturned. We are going to help assemble that. Doesn't mean we're going to do all of it, but we're going to work with our partners and make a very serious part of our role is to connect the dots of what children need to be successful.
Thank you. Beth, talk to us about collaboration.
Sure thing. Well, mental illness, as we all know, is a very complex issue, and there's not one single solution. So collaboration is really important. The three of us on the stage do a lot of collaboration across our services, and just there's so many great mental health organizations across our city that we work with in tandem and others. But a couple of things that come to mind for me at Skyland Trail in terms of the pipeline, and we do have internships that at Skyland Trail with a lot of schools around the southeast and up the coast. So we are adding back to the pipeline. We have interns from Emory School of Medicine. We have child and adolescent fellows at our adolescent campus. We have students from Mercer, from Oglethorpe, from Emory, University of Georgia, that come through and do long internships, get some great exposure to the patient population at Skyland Trail. So we're really happy that we're kind of adding back to that pipeline of education. In terms of schools, I think that's one of the places we can have a huge impact in our city with teen mental health. And we're invited out we have collaborations with the Atlanta Public School System, private schools, and we are not just educating teachers and parents about mental health, what it looks like, warning signs, and what to do. We're also going into the student bodies. We're educating middle school students and upperclassmen, talking about recognizing signs of mental health issues and what to do. We're also bringing in some of our program graduates that have gone through the Adolescent campus, have graduated, they've turned 18, that can go back into the schools, talk to those upperclassmen, and tell them what it was like for them while they were in school, and maybe they were bullied, they were isolated, they weren't picked for a team, and what they can do to really help their peers through these mental health crises. The last thing I want to note is just with a special collaboration we have with Georgia Tech. They have a program called the Clark Scholars, and the Clark Scholars was established for first-generation students attending college that needed a little extra support. One of their students at Georgia Tech in 2021 was a patient at Skyland Trail, graduated, went back to Tech, and realized the skills he'd learned, the DBT skills and building resiliency and mindfulness, would be very helpful to some of his peers in his cohort. So we are now going down to Georgia Tech and doing mental health education to people in the Clark Scholars Program every semester. It's a series of 6 education programs where our clinicians go in there. So it was little things like that that are making a little bit of a difference step by step that are going to make a big difference later on.
Thank you. Those are great examples. Would you like to also speak to collaboration? You already did earlier, but would love to hear any other thoughts you have on
Just
this.
a shout out. With Skyland Trail, this may seem minuscule, but when dollars are so hard to raise and come by, Skyland Trail and Hillside do a lot of marketing efforts together. Why repeat and spend money marketing when we are marketing to a similar audience? So we do a lot of collaboration in that. And then I think what's key, when we get a referral from Children's, which we do, sometimes it's a case that the child has really had some extensive trauma, and we know that their pattern is to do something to go back to the emergency room or go back to the hospital, because sometimes it's easier than treatment. Treatment's hard work. It's emotionally draining. So we've worked with Children's often on these cases to say, okay, let's put a plan together. When this child exhibits something where they need to go to the emergency room, Dr. Weinshank will call us. We'll know what the plan is so that we can kind of extinguish that desire of theirs and get them back into treatment. That is absolutely critical for the success of our children. If we're not collaborating and working together and even referring cases or kids that are better suited for another provider, then we're really failing the child. So collaboration is key.
Thank you all. Before we open it up to Rotary members to ask your questions, I'm going to ask each of you to offer some advice to our room full of folks here. So we've got parents, grandparents, aunts, uncles, siblings. Everybody has adolescents in their lives in one way or another. And what advice would each of you give to these folks here about what they can do, what they can look for, how they might help the adolescents in their lives and also in our broader community? So opportunity for advice for these good folks in the audience here. We'll go right to, actually, we'll start with you. We'll start the other way. Emily, go ahead.
So, advice. One thing I would make really, really clear is there are a lot of levels of care. And what we find when we go to educate families and the audience at large, people don't realize that there's more than just outpatient treatment and hospitalization or residential treatment. There's a lot in between. And whenever we can keep a child at home with their family while receiving very intensive treatment to address their needs, it's a win. That can't always happen, but I would say anytime you encounter someone whose child is struggling and outpatient is not enough, please, if nothing else, call us so that we can educate you on the various levels, because there are very, very effective ways to keep that child with you and engaged in community, which is so important, before you would have to resort to a residential treatment or hospitalization.
Okay, I'll take the easy ones. Well, if your kid is normally outgoing and they're suddenly isolating in their room, that's a warning sign right there. Look for changes in behavior, changes in appetite, changes in sleep, and do something about it. Call us. The other thing I just want to encourage everyone to do is to talk to your teen, ask questions. How's school? Why do you want to stay in your room? I think people are afraid to directly address their teenagers with some of these important questions. Grandparents, siblings, ask questions.
Completely agree, and I'll just add one thing to what Beth said about change, is change in function. If it wasn't, clear that when a child is really changing in their capacity to do what they normally do, that's always a major red flag, and something that you really want to respond to and think about why is that happening. And when it comes to asking youth about what may be happening to them, or what they may be thinking about or worried about or distressed about, there has never been any compelling evidence that asking induces a problem, ever. It doesn't matter what you ask about. There is no evidence for that. So don't be afraid to ask and open the conversation. And I would say always have an eye towards safety first. In the hospitals, the first thing that we do in the emergency room is stop the bleeding. And the same is true for a mental health emergency. There is a thing called mental health first aid that everyone can learn. There are practices and ways to approach a person who's having the origin of a mental health condition, that the most important thing is to shepherd them to safety, because essentially in childhood, the catastrophes are the things that end a life and cut a life short in childhood that we could try to reach and prevent from ever happening. And that is such an important goal of all of youth mental health, is to keep kids going and keep them out of the woods. So.
Hey, John, how do people learn about mental health first aid? Like, is there a course that people can take?
Absolutely.
Yeah.
There's courses in that, and we can get information circulated to the group about how to take a course in that, and just be equipped to be able to handle that.
Yeah.
You don't need any special education to take that. Yeah.
Okay, great. And I would just add my own advice, which, coming off of Thanksgiving, where hopefully everybody had Thanksgiving dinner without their phones at the table. And have more of those. Just, pretend it's Thanksgiving. During the pandemic, we had a house full. Our kids came home, and other kids who didn't have good homes came home, and it felt like Thanksgiving almost every night. That was the good part of the pandemic. So have more Thanksgiving dinners when it's not November, whatever. We have questions. Maybe introduce yourself and pose your question. We'll try to get through as many as we can. A little bit closer.
I'm Zach Young.
No.
Just okay, I'm old.
Hold it, yeah.
Thank you all for what you're doing for our children. I have a grandchild who has had issues since cognition. And one of the problems that my daughter has with my grandchild is his condition is not really diagnosed. He has these symptoms. And what she wants more than anything else is a support group of other parents who are experiencing the same issues with their child, and she can't find that. And every time we're going through Jacob's Ladder, which I'm sure all of you are familiar with, and my grandchild has been there for several years, not full-time, but part-time. But frustrating for my daughter not to be able to talk to other parents who are dealing with something that has not been diagnosed and apparently is not able to be diagnosed by the medical field. Could
Thank
you
you.
tell me if that is common and what my daughter can do about that?
Well, two questions. One is it common? And the second, what about a support group? Seems like a good request. Yeah.
Well, your daughter's intuition is phenomenal to reach out with other families, parents who are going through the same thing is very, very important for all parents. It is extraordinarily common to not land on a singular diagnosis. We used to think that psychiatric conditions were separate from neurologic conditions. The genomic revolution has changed all of that. You can have a little bit of this and a little bit of that, and more of this and more of that. All of it's quantitative. And so it can be very, very difficult to get a singular diagnosis. That doesn't mean that there's no treatment strategy or no plan for a patient, because really symptoms still are the coin of the realm of all mental health, because we don't have biomarkers. We have biological treatments, but we don't have a test for any condition that would specify a given mental health condition versus another. So it's extraordinarily common not to have a firm diagnosis. It is still very, very possible and important to treat a constellation of symptoms that comprises any child's unique condition, and it is a really important intuition to want to get help from joining other families who have been through it. And I promise you, there's a long queue of families who are experiencing, even though your grandchild is unique, there are plenty that have very comparable combinations of concerns, and that there are plenty of parents out there that are managing.
And Zach, I would just add to that, something that comes to mind immediately is NAMI, Georgia, in terms of support for your daughter. And if you and I could connect and I could give her some resources. But that's just one that comes to mind, and they're a great organization, and it stands for the National Alliance for Mental Illness. There's a Georgia chapter. We have them all over the city, and it's parents who have children, both adult and adolescent and young children with a mental health issue, and it's a monthly support group, and they're all over town.
And they're all over the country too, in case she's not in Georgia.
So much. Lauren Kuhn, I'm a big fan of all of yours and the work that you do. I'm with an organization that works with literally tens of thousands of youth every year, and we see mental health continuing to be an issue. As we began to invest in social emotional learning and mindfulness.
Lauren, bring it closer to your mouth.
Sorry. As we began to invest in social emotional learning and mindfulness for children, I had a doctor explain to me one time what happens to learning and to the brain when the fight or flight or trauma kind of portion of your brain takes over, and it really stuck with me. Dr. Constantino, I'm sorry to put you on the spot, but can you talk about what happens in a child, an adolescent brain, when that fight or flight takes over?
Sure. I mean, I think what will be most familiar to most people is the sort of stereotypic response of a combat veteran. That an experience that's completely overwhelming / life-threatening essentially topples the whole system for being able to manage what is that, how do I think of myself, how do I keep myself composed, and so forth, and then starts to recapitulate itself, the memories, the triggers of those events, and so forth. And so there's many children, especially young children. It's very interesting. There's young children who will be misunderstood for being hopelessly hyperactive or hopelessly impulsive, that are often really responding to little triggers in the environment that are activating what has been arousing to them, overwhelming to them, scary to them in a way that they are not ready to handle or to manage. So that fight or flight system that operates in a combat veteran for a formal diagnosis of PTSD in relation to what they experience is almost the exact same thing can happen from an emotional or any kind of an event that is strongly traumatic to a growing child and brain. Yeah.
I think we have time for one more question. Is that right?
We're going to take
We'll
them both.
we'll take both questions. Okay.
Cole, Matt, Cole, when I was in education, we found older adolescents, young adults, whose family had private insurance, so they didn't qualify for Medicaid, and they didn't have the money to do Shepherd Pratt for 6 months. What is the option for the middle class cost-wise?
If I could
Yeah.
speak to that, that's one of my greatest concerns. The population that we serve at Hillside, like I said, is about 50% Medicaid, 50% private insurance, and both have struggles when insurance begins to stop paying for services when they determine they are no longer needed. 9 times out of 10, my clinical team disagrees. Just as we've talked about, children who have undergone trauma or are dealing with a mental health diagnosis, it takes time. Treatment takes time. You won't be finished in 60 days. And so I know, I think all of us have to raise money to provide financial aid and scholarship for families so that they can continue the treatment beyond the point of insurance paying. We spend a lot of our time and energy conversing with insurance companies about meeting medical necessity and what a child really needs on their pathway to healing. And it takes a lot of effort, but scholarship funds is something that we all do so that we can piece that together for a family who doesn't have the means to pay for it out of pocket, because it can be very expensive.
Well, and maybe move the community to let the clinicians decide what's medically necessary and go from there.
And Emily was very nice. She said discussing with insurance companies, but it's typically fighting with insurance companies. But, you know, I just want to add that the Affordable Care Act has really expanded accessibility for a lot of families to have coverage for insurance. And while that's great, these families really are dependent upon the insurance. So when insurance runs out, they can no longer afford care, which is why all of our financial aid programs are so important. So when insurance does run out, it extends their care to get them to the end of treatment.
And the only thing I'd add here before we go to our final question is, I don't know if Paige Alexander is still in the room, but the Carter Center is doing quite a bit of work there she is, to ensure that Georgia is really living into its Mental Health Parity Act so that all Georgians can have the benefit of the mental health services they need. Last question.
All right. Thank you all. Arun Mohan, thank you for being here. I got a two-part question. First, you mentioned at the beginning that Georgia's near the bottom when it comes to access to mental health resources.
Closer.
Is that the right metric to think about as we understand mental health at the regional level, or are there other metrics we ought to be considering? And then second, are there states that you see as leaders in this? I'm curious what we can learn from them.
Go ahead, John.
Well, one thing I would say is that I'm not sure that we want to aspire to any state for mental health. Like, we may be 48th, but it's among, a lot of problems that every state in this country wrestles with to make sure, particularly for under-resourced children and families, are getting what's possible based on the evidence base of our field. So I personally have set aspirations to exceed even whoever is ranked number one for whatever reason. And I think one of the ways to operationalize that is that if you think about the most catastrophic consequences to a life of a mental health condition, those include death by suicide, we talked about that, a life of delinquency, a life of substance use, out-of-home placement, dropping out of school. Those are the kind of things that I would love to see us move the needle on. And the the rankings can work out for themselves. I think that's where we need to show that great mental health treatment can get us to a different place in the lives of the long lives of children even after childhood.
Thank you
Great.
very much. I think we're ready to wrap, right, Kathy?
Yes, we are. Thank you all for a wonderful program on a very important topic. Thank you so very much. So we are quickly headed towards, can you advance it, please, the end of the year. I was asked to announce that the Education Advisory Council meeting is in the boardroom after this meeting, so do not leave if you're part of that council. Next week, December the 8th, we have Brian Blake. He's going to talk about Georgia State as an economic catalyst. On the 15th, we have Rotarian Daughter Day, and Blaine Alexander, Dateline correspondent, will be with us. And then we are off for 3 weeks. So again, we are hurtling towards the end of this year. Look forward to seeing you all next week. Meeting is adjourned.